Hey everyone! Welcome back to our channel. Today, we're going to dive into a topic that is close to our hearts and something we believe needs more attention. Children's depression. That's right. We often talk about parenting tips and family adventures, but it's important to address the challenges that children face when it comes to their mental health. It's a subject that needs more attention, and I believe it's crucial for us to have an open and honest conversation about it. So, thank you for joining me today. Throughout this vlog, we'll be exploring the signs and symptoms of children's depression, understanding its causes, and discussing effective strategies for parents, caregivers, and educators to support and uplift these young individuals. Depression in children. Depression in children is a serious mental health condition characterized by persistent feelings of sadness, irritability, low self-esteem, and a loss of interest in activities. It can affect children of all ages, although it may present differently in each age group. It's important to note that depression is not a normal part of childhood or adolescence, and should be taken seriously. Here are some key points to keep in mind when discussing depression in children. Prevalence. Depression in children is more common than many people realize. It is estimated that around 2–3% of children aged 6–12 years and 12–20% of adolescents experience depression at some point. Symptoms of depression in children. Symptoms. The symptoms of depression in children may include persistent feelings of sadness or irritability, frequent crying, loss of interest in activities, changes in appetite or sleep patterns, low energy or fatigue, difficulty concentrating, feelings of worthlessness or guilt, social withdrawal, physical complaints without a medical cause such as headaches or stomachaches. Causes of depression in children. Causes. Depression in children can arise from a combination of genetic, biological, environmental, and psychological factors. It may be triggered by a major life event, such as a loss or trauma, or it can develop gradually over time. The causes of depression in children can be complex and multifaceted. It is often the result of a combination of genetic, biological, environmental, and psychological factors. Here are some common causes and contributing factors. Genetic factors. Children with a family history of depression or other mental health disorders are more likely to develop depression themselves. There is evidence to suggest that certain genes may increase the risk of developing depression, although the specific genetic factors involved are not yet fully understood. Biological factors. Imbalances in brain chemicals called neurotransmitters, such as serotonin, norepinephrine, and dopamine, are believed to play a role in depression. Additionally, hormonal changes during puberty can contribute to mood fluctuations and increase vulnerability to depression. Environmental factors. Adverse experiences or stressful life events can trigger or contribute to depression in children. These may include the loss of a loved one, divorce or separation of parents, neglect, chronic illness, academic pressures, social isolation, or significant family conflicts. Cognitive and thinking patterns. Children who have a negative outlook on life, low self-esteem, or a tendency to interpret situations in a pessimistic or self-blaming manner may be more susceptible to developing depression. Perfectionism, excessive self-criticism, and an inability to cope with failure or setbacks can also contribute to depressive symptoms. Social and interpersonal factors. Difficulties in interpersonal relationships or a lack of social support can impact a child's emotional well-being and increase the risk of depression. Feeling isolated or socially excluded can also contribute to depressive symptoms. It's important to note that while these factors can increase the risk of depression, not all children who experience them will develop the condition. The interplay between genetic vulnerabilities and environmental factors is complex, and the exact causes of depression in individual cases can be difficult to pinpoint. Early identification, appropriate support, and intervention are crucial in addressing depression in children and helping them navigate their challenges. How to cope with children's depression. Coping with a child's depression can be a challenging and delicate situation. It's important to approach the matter with sensitivity and provide the necessary support. Here are some steps you can take to help a child cope with depression. Validate their feelings. It's important to acknowledge and validate your child's emotions. Let them know that it's okay to feel sad or overwhelmed and that their feelings are valid. Avoid minimizing or trivializing their emotions, as this may make them feel unheard or misunderstood. Seek professional help. Consult with a mental health professional experienced in working with children and adolescents. A therapist or psychologist can provide a comprehensive assessment, diagnosis, and appropriate treatment plan tailored to your child's needs. They may recommend therapy, counseling, or, in some cases, medication. Encourage healthy habits. Help your child develop and maintain healthy habits that can contribute to their well-being. This includes regular exercise, a balanced diet, and sufficient sleep. Physical activity can boost mood and improve overall mental health. Foster a supportive environment. Create a nurturing and supportive environment at home. Encourage positive relationships, both within the family and with friends. Ensure that your child has a strong support system and access to social activities that they enjoy. Encourage pleasurable activities. Encourage your child to engage in activities they find enjoyable and fulfilling. These could be hobbies, sports, creative outlets, or other interests. Participating in activities they love can provide a sense of purpose, accomplishment, and happiness. Teach coping skills. Help your child develop healthy coping skills to manage stress and difficult emotions. This can include deep breathing exercises, journaling, mindfulness techniques, or engaging in relaxation activities. Encourage them to express their feelings in a healthy manner. And that wraps up today's vlog on children's depression. I hope this discussion has shed some light on this important topic and provided you with valuable insights. Remember, if you suspect that a child in your life may be experiencing depression, don't hesitate to reach out for professional help. Mental health professionals can offer guidance and support tailored to their specific needs. Let us work together to create a compassionate and understanding environment for our children. Encourage open conversations about emotions, foster resilience, and let them know they are not alone. Every child deserves love, understanding, and the opportunity to thrive. Thank you all for joining me on this journey today. If you found this vlog helpful or know someone who might benefit from it, please consider sharing it with them. Together, we can make a difference in the lives of our children. Remember, no matter how difficult things may seem, there is always hope. Let us continue to support one another and create a brighter future for our children. Until next time, take care, and let us keep spreading awareness and understanding about children's mental health.